These are my x-rays.
Let's
from
watch
the
Hayley
chiropractor.
Williams from Paramore.
Be like, oh, you're gonna regret headbanging like that. And I continued to
Wait to watch
headbang
me
and get
explain.
myself whiplash for a really long time. But I woke up one morning, I like couldn't look to my left, and I thought, it's time to pay the piper.
So she's got a point. What are the risks associated with headbanging? I went to the literature, and this is one of the better articles that I could find. And I also used a little bit of common sense. When one headbangs, you aggressively flex and extend your cervical spine. That causes angular head velocity and stresses your cervical spine and your brain. The deceleration and acceleration can transmit force that is unnatural. Upon my review of the literature, there's not a lot of clear associated cases to any particular type of injury. However, we do know that it can increase the risk of disc injury, whiplash type injury, or even traumatic brain injury. Cases of stroke, even related to carotid or vertebral artery dissection, have been documented. So Hayley Williams' description of her having neck issues related to potentially headbanging is not unreasonable. This article referenced a theoretical model utilizing the two biggest headbangers of all time, Beavis and Butthead. Beavis typically achieves a range of motion of about 45 degrees when he headbangs, but Butthead utilizes a range of motion in around 75 degrees. If you use the song I Wanna Be Sedated, it has a tempo of about 164 beats a minute. Either one of them would meet the threshold of a neck injury criteria. However, it does predict a level 1 head injury based on the head injury criteria, which could cause dizziness and headaches. Interventions to potentially reduce your risk of headbanging includes limiting your range of motion, warming up before performing headbanging, and strengthening your posterior chain to train your cervical neck muscles to tolerate this type of activity. Follow for more.